Welcome to the recording of the webinar, From Vaccination Hesitancy to Health, Bridging the Gap. The presenter is Professor Dorit Nitzan and the webinar is hosted by Dr Ferdinando Petrazzuoli. This webinar was recorded on the 24th of July 2023.
Good evening, dear colleagues, ladies and gentlemen. My name is Ferdinando Petrazzuoli and I'm a member of the WONCA Europe Executive Board. It is a pleasure for me to introduce Professor Dorit Nitzan from the Ben Gurion University of Negev, Israel. And the topic of this evening webinar is vaccination hesitancy. Please, Dorit, you can start.
Thank you so much, and I'm really honored to be here with you. I'm trying to share the presentation. Hopefully, it's working. So, thank you very much, Dr. Ferdinando Petrazzuoli. I'm trying to remember how to say your name. I practice it many times, and I'm really excited to be today with the most important people, the most important health professionals that are our face to the people of the world. I'm a pediatrician in my background, a nutritionist and a pediatrician, and I came back to Israel a few months ago after more than 17 years in the World Health Organization. In my last position in the past years, I was the Regional Emergencies Director in the WHO European region. And therefore, I've been dealing with outbreaks and vaccinations, as well as our latest pandemic, which really shook us up. So today we are going to look at how and what is the issue with vaccination hesitancy and try to highlight some points that I thought that through the years that I've been facing different communities in different parts of the world, how they see the things. So here I think we are, when we speak about vaccinations, we are speaking and putting side by side the pull and push vectors of those of us who would like to invest in prevention against those who just understand things when we are sick. They are those for the care. And the pull and push, these vectors have been working through the world. And what we've seen that side by side with the development of vaccines came vaccine hesitancy. It is a long process. It's long, for many generations, it's been with us. Even before we were aware of it, when we go back, we understand that there always been vaccine hesitancy. And now, with many generations that have not witnessed any of those diseases, luckily, they are very fortunate. Not in, like in my class, we had few, not my class, but maybe a bit older, they had polio. We had people with polio and they were with paralytic disease, and we know that you don't want to be sick like these kids. You have to get the vaccines. Today, many of the parents have not been experienced, were not been exposed to this, luckily, but they forgot the wonders that vaccines do. And many times when we have the opportunity to speak with them, I ask many times when people come and say that they are obese, I say, if there would be a vaccine against obesity, would you like to use it? And they say, of course. And I ask, if there was a vaccine against heart attack, would you like to have it? Yes, of course. How about high blood pressure? So you understand that many times it's the threat that actually does not exist. And when you put the threat in their face, you understand that the gradients of how things work. And in every community, everywhere in the world, we see that some people do not trust the vaccines. Some accept, but are not sure. Some accept some of the vaccines, but delay and refuse some others. Some refuse, but are not sure why they are refused. And some, very few, refuse them all. And interestingly, for example, in Israel, where we have diversified communities, we have the Arab communities, the Jewish communities, you can see, for example, that the Arab communities are best at vaccine coverage. They are complying with the vaccination schedule. They don't think twice. Most of our hesitants in the countries come from other side, from the Orthodox Jewish community or from those green and healthy people that do not want to have anything to do with vaccines, but they have other things in life that they are happy to take, like some drugs, marijuana, natural things, as they call it. When we look at the coverage, we can see that there is rational and irrational spectrum that is composing the whole idea. And there are 5 C's that threaten the coverage, the vaccination coverage. The first one is clear, it's communication. If the vaccines are brought without adequate communication, and we will speak a little later about the vaccinations that had to do with the COVID. So if we were in rush to vaccinate people, or we did not communicate it well, that could cause some hesitation. The complacency, the context, confidence and trust and convenience are very, very important. I would like to emphasize convenience. Sometimes in some communities, and not only in Israel, also in other countries, we saw that families that are remote from the services or have many children and cannot keep track of who needs to be vaccinated when and where, etc. This child is sick and this child needs to be vaccinated. Due to lack of convenience, many of them would opt not to vaccinate. We should not include them in the hesitancy scale. They are not hesitant. When we come to their home with mobile vaccination clinics, when their primary healthcare system comes to their doorsteps and inside their residence, things change. They understand the importance. So the factors that I like to look at vaccination, it's the vaccination coverage security. I borrowed this terminology from the food and nutrition security, where we look at availability, accessibility, adequacy, and utility. That means that in countries or communities where vaccines are not available, just as we saw with the COVID-19 with the vaccines, some parts of the world were not vaccinated. They will never be vaccinated because they didn't have any vaccines available, because other parts of the world kind of hoarded all the vaccines that were available globally. As I said before, some of the people are not accessible and do not have access to the services, to the vaccines. And in many places, we lack the primary healthcare staff. And in some countries, even in Europe, I saw that there are areas, rural areas, where we see that the primary healthcare is not, they do not invest in these people. And sometimes you have one nurse or nurse practitioner that covers many and cannot access them all. We need to know when to vaccinate, how to vaccinate, to do it in adequate way, and we need how to speak and discuss it with the carriers. And of course, the utility of vaccines and the utilization and reporting and following it up. All these are very, very important. So as I mentioned, the collaterals of the COVID-19 vaccines, lots of collaterals happened. And I think it will take us some time to think, really to understand in depth what happened here. What happened here is that science was good. Science was excellent. We finally got to the stage that we could develop the world. I'm saying we, I had nothing to do with it, but the geniuses that could think of mRNA to do that and this and to bring things together so quickly. This was absolutely amazing, but this rapid development did not kind of reason with the way people think. People think it takes years, it takes so many steps, it cannot be. They don't understand. I never remember the day when, you know, as a pediatrician, did any of the mothers, even in the United States where I practiced in New York, no mother ever asked me, which producer you are giving the measles, mumps, rubella? What was the producer for the DPT? Don't want this one, I want that one. Never heard it. Here, we gave so much information in such short time that with all the respect, we confused us all. Even us, the doctors, the primary healthcare doctors, including a pediatrician, we were confused. What's going on here? And this is where things start to move around. Many did not grasp the medical countermeasures in general, you know, not only vaccines, all these. An issue you all remember that we call it fake, terrible name, public health emergency of international concern, as opposed to pandemic and all these. When Dr. Tedros, my previous big boss, when he declared public health emergency of international concern, and then later on a pandemic, the world started to mobilize itself like crazy, closing borders, doing things, and the vaccines were put on top of it. So people didn't understand what's going on. They couldn't grasp what is going on, why we are doing that to them. The government took control of the people. You know, it's like as if an imaginary machinery kind of came to the world. And of course, with that machinery, it gained a political dimension, right and left and fights and pro and cons and this politician and that politician. I don't have to name them, you all know them. With all of this taking these pull and push vectors, the people start to think, what is going on here? Why do I need it? So this is time for us to understand and not to let them be alone. And many of the issues that personally I think is due to the fact that we weren't strong enough to tell that that the vaccines are safe, that that's the best thing that we can do, and that there must be standard operating procedures for monitoring adverse events following vaccinations. And when countries or communities that did monitor the adverse event, and I'll speak about it a bit shortly, those countries could see the difference. The whole issue of creating a black hole within the communities, the global communities, partially because they had no availability of vaccines, those that have no access to vaccines, and those that were hesitant, became a huge threat to the One Health security. And with the COVID, it's not such a big issue after all, because we kind of succeeded to overcome it amazingly, if you think about it. It's something that will be learned for years. Many, many good things were done here. But the threat to One Health, and One Health means the health of environment, plants, animals, and humans. The threat of those that around us, the whole planet, is there because one day we are so divided, so weak, and so not well managed that there will be something bad to society if we don't have the power to take it. So let's just see how it is. So we have pulling and pushing vectors. People from this hesitancy spectrum have strong social network. We have to understand they are glued to each other. They have their communication. They know how to get into each other. They take care of each other. They speak, they help, hold their hands and walk themselves through it. You can see them, and their social ability is amazing. They are supported also by some of our great colleagues. You know, this is something big when you think about some of the great doctors that I respect, I fully adore and respect, my teachers, I see them in that side and I think, okay, maybe they are right, what's going on here? And maybe in some points they are right. Maybe we should try to understand, but we have to really, really open our hearts. The people that are linked to each other, they kind of created these networks and clubs that attract people with the same stance or those that are on the hesitancy scale. And they created this, what I call social pods. This group have amalgamated further during the COVID-19 pandemic and have really become kind of very strong in many, many countries and communities. I don't know what happened here. Yeah. They have stood together across countries, across borders, in very cohesive group, and they spread their position over social media so much better than the others, than those that are doing the routine things, the vaccines, which are absolutely not routine. This was out of the box, great invention that created such animosity around the world. So in some instances, health professionals added to this communication, and we saw how we cannot come united as one front against a kind of nasty virus, but not the nastiest. The nastiest is still waiting to come. And here I always remember, as I said, I came back to Israel, to my country, after more than 17 years in the World Health Organization, but in the last years I was in Copenhagen. And I remember that I learned about the Viking shields. And if you know the Viking shields, they used to take the shield, each of them, but create kind of a globe. They didn't stand in one row so that the arrows could enter between the shields. They really covered themselves, and that we lack. We lack the ability to come as one humanity that works together. So I would like to propose to those 5 known C's that we all learn, one other C, which is cohesive communities. These cohesive communities are something that we need to think and learn and use the social science experts to work with us hand in hand. So all of these 6 C's that I mentioned are anchored in contextual influences and issues, in individual and group influences, and in vaccination-specific issues. What I mean? In the context one, I mean the media and public, but what I emphasize here, local politics, religion and culture, and cohesive communities. These are very important issues that we have to mark and learn about our own communities. When we look about the individuals and the groups, we look at the beliefs, the knowledge, poor quality of health services, of course, but again, cohesive communities. And vaccination, when we look at it, the main issue here is the community and networks position. And the first one are the health workforce. And this is why it's so important to put the primary healthcare workforce at the front. First of all, we have to understand if our workforce, what they feel, how they think and look at vaccines. do they have some hesitancy? It's okay to be hesitant. It's okay to think and to learn. It's okay to ask questions. It's okay to argue, as long as we really do it evidence-based, as long as we don't lose the grounds of science, medicine, and all we learned all these years. So putting the focus on the primary healthcare workforce, and I mean the physicians, the nurses, the pharmacists, whoever is in the field there, the nutritionist, whoever is in the field there that have the contact with the people, and those who can describe to the people what they should benefit from. Offering vaccination as a default is very important, but we need to identify those that I call them on the hesitancy spectrum. We need to identify the hesitancy spectrum, and in my office I have kind of a ruler, and it's from 1 to 10. And when you see a person, after I ask a few questions, you try to put them on this ruler. Where are they on the spectrum? Because you want to right away identify their stance. And you can see from their reply about vaccinations, they respond, I'm ready. Or someone would say, okay, I will vaccinate. Or I don't know, I have doubts. No, I'm not sure that this is right for my child. And I don't trust vaccines. Of course, there are many ways to say it, but the gradients, and when you see the gradients, the body language, you understand where the parents or the people are. We many times see that the primary healthcare or those who provide the vaccines are either more directive or they are argumentative, and there are different styles and different ways to address, but it has to be specific to the case. And WHO has a training specific for that to show how to communicate it. But first, the person that is in the primary healthcare, the one that is at the front, should absolutely feel in harmony with him or herself. So the interview that it is recommended to do, we call it motivational interviewing, exploring the reasons. First, we look at the health workforce. As I said, we need to identify the health workforce that are in doubts and to use a community-centered platform. Here, from the experience we see in some communities, we need to explore and build supportive and bridging social pods. We need to really build good communities that work with each other so that people that vaccinate their children will also have support, will also feel that they belong to these pods, to these nests, that they are also kindled by the community. They also have the support. And I saw in some primary healthcare centers that they actually refer and create groups of parents that are together, standing together, helping each other, and become friendly due to the vaccination, with the vaccination, and creating games together and things for the children so that they will stay together. With this people-centered approach, it's good because the parents can interact, the children and the parents can learn, they can explore, and the primary healthcare, we can bridge, we can give a hand from one another, we can see how we can build a system that is actually building stronger networks than those that are opposing us. So there are many do's and don'ts when we discuss it with the people. We would like to see that we take the guiding style, that we work with the parents, we work with the community, we explore doubts and interests, and we take time to reflect. But that needs time. And all of us, all the primary healthcare workforce around the world don't have time. Many of us are put under stress with lots of paperwork, computers, etc., and need to focus on the people while they have to fulfill their jobs in other side. So this is something that I think that all of us have to unite and request. And now a bit back to monitoring adverse events. If you look at the adverse events, they are the key to trust. Because when one case of adverse event can make it around without being notified actively, without being taken care, this can destroy the whole system. So adverse events must be monitored. And we have few types of adverse event. We have the EFI. These are the adverse events followed immunization. These are unwanted medical events, occurrences that follow immunization. Here, we don't need to have causal relationship. We don't need to prove it. We need to document it because there are rules when these adverse events come and to mark it. The system should be ready to collect the data from all these adverse events because they ignite the causality assessment. If we continue to do this, it's kind of passive, of course, but when we see adverse event, we report on it, and then we see that it comes in other places, it ignites the assessment. We don't have to say to the parents, oh, it has nothing to do with the vaccine. We monitor and we document it. So it is identified through spontaneous reporting. The other side is ASI. ASI is adverse events of special interest, a pre-specified event that has a potential to be causally associated with a vaccine. For example, if we heard about myocarditis, one case here, one case there, one case there, comes the ASI. Through the ASI came the ASI. And the ASI is the one that we identify via active surveillance system in sentinel sites or going retrospectively in electronic health records. Very important to ensure that we do it. Otherwise, we'll never know what's going on and if people are right or wrong. I won't take your time to think about the in-country reporting process, but I would like you to understand that the active surveillance, the ASI that you can see here, it is coming from the people and back to the people. And ASI is something that would lead us to a very concrete assessment research, and we will try to see what is absolutely need to be done. We don't take it lightly, okay? So if we look at the adverse events, some of them can be done through passive surveillance. And passive surveillance is something that we have to always do. We cannot skip passive surveillance. ASI can be implemented, as I said, through cohort event monitoring. So after the passive surveillance identified something, alerted us, we have to go for the next step, which is the active one. And there are specific protocols, tools, and ways to do it. And we have to take it seriously and know it. I would like to, for those of you who've never heard about it, the Uppsala, the Swedish Monitoring Center, UMC. This is an amazing center. It's a WHO collaborating center that provides training, guidance, and support to countries for international drug monitoring. So all drugs, including vaccines. they manage what we call the VGBase. It's a WHO database of individual case safety reports. So here you can understand that all those reports are coming to a central place. And even if it's 1 per million, but 1 per million here and 1 per million there, 1 per million, this global center can tell us about the truth about the suspected side effects of any medication and vaccines. And this is important to know. You can go to the Uppsala website and learn about it. They are doing all the vaccine safety monitoring, and for many, many years. It was established already in 1978. And many times when I speak with even governments, they forgot that they have that tool. So many governments do report to Uppsala as required, but some don't do it as needed. What does it show when we look at the studies? We saw that COVID-19 vaccines are indeed safe and effective, and severe reactions after vaccination are rare, but they do happen. Anaphylaxis is rare. Thrombosis with thrombocytopenia syndrome with Janssen can happen rarely. Guillain-Barré syndrome, again with specific vaccines, rare but happen. Myocarditis and pericarditis, rare but happen. So death reported rarely but happen. And when we look at this and we say, okay, the benefits of the vaccine against this, of course, the individual that gets that side effect and the family, of course, need to be compensated, and we need to support them fully. But when we look globally at the impact and the side, unfortunately, we need to continue because that's the best we have, the best tool we have so far. The confidence, if we speak about trust, I think we have to speak about confidence. The confidence is something that is an ongoing challenge. Low vaccine confidence is one of the world's most pressing public health problems. But let's not exaggerate. Most of the children are vaccinated. If you look at many countries, those who have available and accessible vaccines, we have small numbers that are not. We just don't want them to spread around. We want to contain them. Some of them will never change their mind, so let's face it, we cannot. But it is going to become a major issue when something very alarming will come to the world, and we will find the expert will develop a vaccine rapidly, maybe even faster than the COVID. So we know that it is a problem, and we know that we have now the time, the break between pandemics to invest and to learn and to approach vaccine hesitancy, not with anger, but with compassion and with understanding, to understand that people do not understand. And no one wants their children or their mothers and grandmothers to be sick, or of course, fathers. We have to share information and knowledge and teach about processes for effectiveness and safety. So we have to teach, we have to create those networks and to teach about the effectiveness, but also give them the tools to ensure that they know that the safety is there, that not only the effectiveness, but also the safety. We have to listen and we have to act. And to find partners within the communities, local NGOs, local volunteering groups, local works, like in some countries, they have a youth movement that can help a lot, and we saw that. We have to collect what we know and to share what we know. And in a way, emphasize also the importance of collective responsibility. Because as we saw with COVID, if we leave someone behind or some groups behind, the whole universe is struggling to survive. We are looking at such compound picture. I borrowed it from the We Forum, and I really like it, because you can see here the health workers refusing the vaccines. They had huge impact on what's going on here. What's going on? Are they right? Are they wrong? We must listen. We have to open our hearts and to start those dialogues, even if we don't understand why. There are conspiracy theories around the world, conspiracy theories about everything. We are the strongest in humans ever. We arrived to the ability for computers to tell us what was said so many years ago, by whom. We can monitor. We are the best in our prime time. We've never been in this prime time. And in this prime time, we developed such tools that are now coming to destroy us. And these conspiracy theories will destroy us, because we lost the ability to understand what's right and what's wrong. Everything is one dimension. Some people had bad reaction, and some death do happen after vaccines, because death happened every day. Unfortunately, we all happen to, I think we will all die one day. So sometimes you have, especially when we dealt with older people, they get vaccinated, and so sad that they passed away during that time. So this is not always bad reaction, but if we have good monitoring system, as we discussed, it helps us all. The issue of herd immunity, we had it coming also, because the pull and push vectors, when you think about it, it came from us, from people that know what they're talking about. And they made this theory, which is well-respected theory. They thought, okay, some of us will get sick, some of us will get vaccinated, all of us will be safe, and that will be okay. So we have to understand how the herd immunity impacted what's going on here. We have to look back with open eyes and analyze, assess it, and come back. And there are many papers on it, of course. I'm not summarizing them. Then we have those that are just scared, as opposed to those who had severe allergic reaction. And those who had severe allergic reaction, as I said, need to be reported. And one of the biggest complaints that we heard in WHO is the long-term effects. Do vaccine, and it started with the autism, it went, if you remember, it went with other issues, but do vaccines have long-term effects on us, especially now with the mRNA? It sounds genetic, it sounds like, oh my God, my DNA through this mRNA, and God knows things will change. And of course, I can smile when they say, come on, but we try not to do it. We try to explain them what is a regular vaccine that they just gave to somebody, and to compare and the process. But do we know it all? We don't. Do we have to follow it up? Yes, we do. So we have to also become a bit humble, which is very, very hard. And that brings me to one of the biggest discussion, the loudest discussion. I mean, loudest in a polite way, because it's all done on papers and diplomatic kind of discussions. These are the discussions about the WHO. It's proposed by the World Health Organization, by the Assembly of the countries. It's proposed by the countries, but WHO is the platform where it is presented. It's the international accord. The international accord tried to give some rules to the games, to the countries around pandemics, and to tell them what information they should share, what to tell each other, and how to handle the global equity issues. And many of those who are against vaccines, but really against vaccines, are now fighting and saying that the WHO, but these powers are trying to take over the world, trying to dictate everything to the countries, take over the control of everything. And you might have heard it. I'm getting really threatening emails. And I understand they just don't understand what we are doing or what WHO is doing. We are not taking the sovereignty of countries. We are not taking their independence. We ask countries to monitor, to share, to monitor the adverse events in the right way, to report on what goods they have inside and share it also with countries. The idea is to leave no one behind globally, and to always, the need is to first do no harm, to really try to focus and do no harm, where all the norms and values and ethics should be very much valued. We should not let them go. We should really focus on our ethics when we bring new vaccines, when we decide which vaccines to give to whom, whatever is done. A long-term approach to building and sustaining trust is something that we need to understand. It's not something that would be easy, because it comes with a package of conspiracies and threats and become something big. But we need to find the way to do it in really organized manner. So if it's okay with you, Dr. Petrazzuoli, I would like to pause here and give the opportunity to those who are with us today to ask some questions and maybe to have some discussions about it, around it. Thank you very much.
Okay, thank you very much, Professor Nitzan. Thank you also for highlighting the important role of primary care in fighting the vaccination hesitancy, because you know that primary care physicians are those who have this special relationship with patients, and so in a way, although not so many have this ability to have to adopt this motivational interviewing approach, still with a good relationship over the years, they can start a trust with the patient. Usually our patients have trust in the doctors. Let me see if there are, can I invite the audience to ask questions via the Q&A box or the chat box? But I have some questions myself for Professor Nitzan. I remember I am a senior family doctor working in a rural setting, and I remember that the vaccination hesitancy has changed over the years. First of all, it's very little in my area, but I remember that maybe 40 years ago, it was just a matter of less educated people who, because of their poor education, they were threatened by vaccine, but they were threatened by all drugs, actually. Over the years, things have changed, and now, as you rightly point out, there are these it's more ideological. This conspiracy theory, this movement that are very strong, linked. They have their websites, their social media, blog, etc., etc. And some, unfortunately, some of our colleagues are their leaders. And I think that they have also too much space on the media, even the official media on TV, compared to the real, let's say, share of the percentage of this movement. What do you think? Have we given them too much resonance, too much space?
Absolutely, I agree with you, because when we look at the percentage of how many people really refuse, they are so diluted into our community, and they are protected by those who are vaccinated. Let's face it. Luckily, they are protected. I tell them that we are protecting them. It's good, but there are few, and many in the countries where we have available and accessible vaccines. That first of all, we see that rural areas are usually more confident because they have very close relation with their primary care, and that helps a lot. And also they have their own, what I call their networks, their pods, they have their own, and they are kindled together. So they are influenced by those. But with urban, when moving to the urban life, people are alone. They get messages here and there. They need support. They need some social support. There are few, but they make lots of noise. And in many situations, we recommend do not invest too much with the refusers. Those who refuse, just, they refuse. What we should invest in is those that are so. And exactly. And those that are not sure, those we should capture and I said to glue them with those who are for vaccines, just like them, from the same social economic group, with the same habits, to find those that can help them and can care for them so that they won't be lonely with their decisions in the big cities. We see them a lot in big cities, a lot among the well-educated, and a lot around those who are green. But there are small groups that are coming with very specific political ideas. And many of them, we can say right away where they belong.
Yes. One of the possible concerns that I have come across, also dealing with my patients, that some people are a bit scared of this, that now there are vaccines for maybe so many disease, pneumococcal, HPV, meningococcal, flu, of course, COVID, of course. So people, anti-herpes zoster vaccine. So people, some of these, say, rural people say, but the doctor, are there too many? Can you reassure us that there are not too many, and our immune system is able to not to get confused by this vaccine?
Yeah, you're right. We have, and thank God that we have so many vaccines, and I hope we'll have more for other diseases, as I said, for obesity, for heart attacks, for for many other things. It would be fantastic if we can all get one shot and be healthy. But in the meantime, we have multiple shots. We hope to get a better way to get vaccinated. It would be so wonderful if we have this bottle of something that gives us health through life. We don't have it yet, but one day we hopefully will. We need to be patient and understand that the parents are confused. there are so many items. And, you know, I just heard about friends of ours in one of the countries in Europe. I won't expose it, but the child, 4-year-old, died from a disease that could be prevented by vaccine. And of course, now the whole community is running to get vaccinated. And that's painful for the parents now. They wake up to a very sad reality.
Okay, we have now a couple of questions from the audience. The first one is from our friend, Professor Shlomo Winker. And his question is about the small outbreaks of pertussis in Israel. Is this the future we are expecting? Why do you have this outbreak of pertussis?
Yes, you know, the first we saw polio, measles, pertussis, everything will come now. And yes, Professor Winker, you are so right. That's the reality, because those people who do not vaccinate their children, and they are all together in those, we know those groups, they are all together in those pods, they will spread it among themselves. I'm so happy that the rest of the population is highly covered. So I don't think that it will see a real outbreak in the country. But unfortunately, some children, and we saw, they are very sick and die. And that is the future. One that doesn't vaccinate with one vaccine usually does not vaccinate with other vaccines. And we see it in the studies we did, that it's a good predicting value for the rest. You're right, it's the future.
Okay,
but
we have now.
Finally, I just want to add to Professor Winker is that he knows it, so I'm just telling it to everybody else. We saw that some of these communities are, once there are cases, they get scared. So hopefully they understand that it's not only to vaccinate against pertussis, they have to really follow everything in the right way.
Okay, we have another question from Jose Miguel Bueno, and it's regarding the artificial intelligence and machine learning. What do you think their influence could be in the next 10 years in the vaccination process? There is a space for artificial intelligence?
I think that here we should be smart to use it to our side. I think that the artificial intelligence is the future. And we need to organize the data to allow the AI to capture it in the right way. And of course, if you put junk, you'll get junk. And that's the sad thing with this artificial intelligence. And we need to build the evidence. We need to do research. I think that primary healthcare physicians have to do research, have to share the data, have to share your knowledge, have to share everything, because you have a mine, a gold mine of, that needs to be shared, and fill the global information with the truth. Otherwise, we'll get junk out.
Okay, there is another question, again from Jose Miguel Bueno. It seems that vaccination hesitancy is promoted by some anti-establishment powers as a proxy war against the system, question mark. It seems that their main interest is destroying the system and promoting vaccination hesitancy, and face mask is the means. So, okay, I think that we could share.
You're absolutely, I absolutely agree with you, because some of this, not all of those hesitants, but some of these hesitants, they come with a full basket of ideas. And as I mentioned before, the political stance of some of them are anti-government. It's not only it's anti-establishment, but anti-government, kind of organized societies that have the rule of law, the rule of, everything is in order. They want to go back to chaos, which we did not have. They don't remember that, even they don't know that hundreds of years ago, the chaos was not something that was good. They are looking for those, and yes, they are anti-establishment, and it comes with knowing more about life. It's one of the things that we have to do. So here, I think the only solution is to improve our education systems, to take care of our kids in a better way, and to raise them knowing more and using the tools we have, the AI, make them think beyond the machines and look in the future. And I think that teachers, we as primary healthcare physicians, pediatricians, we have to strengthen the status of teachers in many parts of the world.
Okay, regarding the pertussis, there are some of these, let's say, old diseases that are now more, let's say, becoming more serious than we thought about this disease that we thought they were almost disappeared. Apart of the pertussis, I don't know if there are any other of these disease that we thought, okay, we have solved the problem, but instead we haven't solved it. For tuberculosis, for example, is one of these.
Yeah, exactly. And we saw it. I returned from Ukraine, and diphtheria is coming back. We see diphtheria, we see measles, polio is and it's vaccine-derived polio, and this is a circulating vaccine-derived polio, meaning that it's an old type 2, polio that is spreading, but the children are not vaccinated, so they cannot withstand against it. So the re-emergence of old diseases is at our doorsteps if that community of anti-establishment, I like Dr. Bueno Ortiz, the anti-establishment people will become stronger and have stronger communities. Our role is to bond the good guys, those that understand our common needs for survival, to bond together and work together.
Okay, I have we have another question from Kirill Manchev. Great presentation. This update our knowledge. The COVID-19 is still here, and we must be more stimulative to share those information through patients. As a rural doctor, the tetanus vaccine is very important too. Take booster dose on 10 years is important for agricultural workers. Best regards. Okay, from Kirill Manchev from North Macedonia. I agree that many of my patients in a rural area are vaccinated against tetanus, which is a terrible visit.
Exactly. And first of all, Dr. Kirill, I like your country very much, regards to your country, but I agree with you. We need to remember those basic vaccines. While we speak about COVID and others, the basic vaccines have the most important role in our lives. And the DPT, the diphtheria, pertussis, and tetanus are key, are basic. Polio, basic. They are coming back to life, and they will be more with us, as Dr. Winker mentioned. They will come back to us if those who are anti-establishment will multiply. And there are not many now, but what will happen in the next 50 years? I don't know. The world is so divided and so politically not going to the direction we want. And that's why doctors like us that work with the people, we have such an important role to guide also our governments and to stay at the doorstep, to really not let those diseases come back.
What do you think about the issue that some of these vaccines, for example, the DFT, as you said, are provided for free during the pediatric age, and then maybe they are not free? Should we give them for free to increase the percentage of vaccination?
Excellent question, Dr. Petrazzuoli. This is key. Vaccines should be provided for free. All vaccines should. This is part of the accessibility. Accessibility is distance, but it's also purchasing power. Asking people to pay for vaccines is wrong. This is basic. It's the basic thing that protects us as humanity, and health security is key for all of us. You know, that once the disease starts to spread, it gets out of control. Some of the viruses become variants and go through mutations. We lose control. So I'm scared that one day, maybe 200 years from now, we will all be here. And because we will survive, we got vaccinated. The others will stay alone, you and me and others here that are older, that got fully vaccinated. In 200 years, we'll have a party. And that will be a very sad party.
Okay, it seems that we have run out of time. I think I can't see any other questions in the chat, so I can say thank you to Professor Nitzan. I hope that all the audience have enjoyed this webinar as much as I have, and good evening, and let's hope that we will manage to fight this vaccination hesitancy in the near future.
Thank you for this opportunity.
Okay, bye-bye. Bye.
Bye.